Hi guys, welcome back to the channel. Last class we have dealt with resuscitation and fluid therapy. Now we will starting with drugs in management part. Okay, let's start. Drugs. First group of drug is sedatives. It is most commonly used to alleviate pain, as in to give relief in pain. Morphine IV avoided in children, head injury patient. Barbiturate is used in children. Barbiturates like chlorpromazine. Okay, injection pethidine for pain relief like in fracture. Okay, these are common sedatives which are used during shock. Okay, now coming to chronotropic agents. What are chronotropic agents? Which increases the heart rate. Chronotropic agents or chronotropic drugs are the drugs which increases the heart rate. So they are used in with slow heart rate. Drugs should be used selectively to patients with bradycardia. Atropine and isoproterenol. Atropine is most commonly used chronotropic agent, or it is used to elevate the heart rate. Okay. Now coming to inotropic agents. What are inotropic agents or inotropic drugs? These are drugs which increases the strength of muscle contraction. Chronotropic agents increases the heart rate. It increases the strength of muscle contraction. When it is used in cardiogenic shock and severe septic shock. In cardiogenic shock and in severe septic shock. What are the example? Dopamine and dobutamine. What are the example of inotropic agent? Dopamine and dobutamine. Low doses increases myocardial contractility and selectively increases the renal blood flow. Inotropic agent increases the myocardial contractility and selectively increases the renal blood flow. And fourth group of drugs are vasodilators. In severe septic shock, traumatic and cardiogenic shock, it is used nitroprusside and nitroglycerin, used in patient with systemic mean arterial pressure. Okay. So, four groups of drugs are used: sedatives, chronotropic agent, inotropic agent and vasodilators. In chronotropic agents are the agents which increases the heart rate. Inotropic agents are the agents which increases the muscle contraction. Okay. Chronotropic agents example is atropine. Inotropic is dopamine and dobutamine. Vasodilator use are nitroprusside and nitroglycerin. And sedatives are barbiturates and morphine are used. Okay. Now coming to the next part, that is monitoring. So we have dealt with resuscitation, fluid therapy and drugs. Now we will starting monitoring, and this monitoring will be the end of the management part. Okay. Monitoring. Once shock is diagnosed, constant monitoring is required to assess the degree of blood loss and hemodynamic impairment. एक बार diagnosed हो गया, established हो गया, then we have to do the constant monitoring to assess the degree of blood loss and hemodynamic impairment. What all we do in monitoring we'll be discussing. First is BP. Diastolic pressure is the main indication of the degree of vasoconstriction. It is directly proportional to vasoconstriction, whereas systolic pressure denotes vasoconstriction along with stroke volume and rigidity of main vessel. Diastolic pressure is the main indicator of vasoconstriction, directly proportional, but systolic pressure deals with vasoconstriction along with stroke volume and rigidity of main vessel. Now, pulse pressure, that is systolic pressure minus diastolic pressure, indicates stroke volume and cardiac output. Okay, pulse pressure, that is systolic pressure minus diastolic pressure, indicates stroke volume and cardiac output. Okay, this is BP. In monitoring, we have dealt with BP. Now, all the rest thing we'll dealing in next class. Till then, like, share, subscribe and comment. Bye.